Welcome you guys to another episode of Roll Call, TTSH Nursing's very own podcast brought to you by the Centre for Asian Nursing Studies, or CANS for short. I'm Kim.
And I'm Chloe, and we'll be your host for today's episode. So together with us today, we have Dr. Keefe Tan, who's a consultant at our General Medicine Department here in TTSH, and we'll be discussing more about nurse-doctor workplace relationships. Welcome to Roll Call, Dr. Keefe.
Yay!
Thank you for having me. Thank you.
Okay, Dr. Keefe is one of our general medicine consultants here at TTSH and has been here for 12 years. So on top of caring for our patients, he also has a strong passion in medical education and guiding young doctors. He's also received numerous teaching awards, including the NUS School of Medicine Junior Doctor Teaching Award, as well as the NHG MVP Award.
NHG MVP. So I invited Dr. Keefe specifically for this episode on nurse-doctor workplace relationships because we worked together for quite a while during the past few years, and it's always been very, very good vibes. So I thought that you were the perfect person, person to invite for this episode.
Sure. Thank you.
No problem. So I think we'll jump straight into the first question, okay? So like we mentioned earlier, you received multiple teaching awards and have a strong passion for guiding young doctors. What sparked your passion for teaching and mentoring?
Yeah, so basically, I mean, I've always wanted to be a teacher. In fact, that's one of the stories. You know, before I applied for med school, I actually applied to be a teacher. I actually wanted a scholarship from MOE. Yeah, so you know, teaching scholarships, I feel like there's overseas and there's local, and obviously the overseas one is more prestigious. So I applied for the overseas one, but I didn't get it because I went to the interview and they asked me a very, very lame question. Okay, actually it's not really lame. Okay, it's a very standard question that people get asked at all interviews. Okay, can you all guess what the question is?
Where do you see yourself in 5 years?
No. It's even simpler than that. You know, it's even simpler than that. Okay, so they asked me, Keefe, so what do you think are your weaknesses? Yeah, and then I was like, huh? Yeah, so I somehow a 19-year-old me thought that I went to a MOE scholarship interview and they would ask me everything about, you know, why you want to be a teacher, blah, 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 why you like teaching. So I prepared for all these questions. Then they asked me what's your weakness. Then I'm like,
what do you mean? I have no weakness.
Yeah, and then like, you know, and then now you tell anyone who's preparing for interview, they're like, huh? That's like a very common question that people always prefer. I'm like, yeah, okay. So I didn't have a good answer to that, and that was the end of my interview. Yeah.
Oh.
So then, I became a doctor. So anyway, so I've always liked teaching, and I mean, even when I was a junior doctor, you know, I was with nurses, and I learned a lot from them. You know, so it's always been that kind of relationship I had with nurses as well as my colleagues. Yeah.
So I guess it kind of bridged, you know, at least you somehow managed to get your teaching.
Yeah, so you know, so people, every time I tell people that I always want to be a teacher. They're like, oh no, so now you're a doctor, you can also do some teaching, which is true, which is what I actually love the most probably about my job currently, the ability to teach the younger ones and then hopefully make a difference to the place you are working in.
Do you feel like your relationship or your dynamics with the nurses has changed as compared to your earlier years when you're a junior doctor?
Oh, okay. So I guess it definitely changed because, you know, now that you're a consultant, right? Then the nurses kind of look at you a bit differently. They are a bit more scared to approach you. I remember when I was a HO, so I started my HO in level 5B, 5 Bangkok. Those who know Sister Ing, Sister Ing, yeah, I remember Sister Ing. Okay lah.
No, I say salute.
Yeah, so that was where I started my HO-ship 2013 in 5 Bangkok, and I remember that when I went there, I was so blur as a HO, right? So everything I would ask the nurses, you know, it was always been my personality lah. So I'm the kind that if I don't know, I'll ask, and I'm not shy to ask. You know, I'm here to learn. No? So I'm gonna ask. You think I'm stupid, so be it. But I'm gonna ask a question, right? So I had that kind of attitude. So I approached the nurses with the same attitude. You know, things like I realized that the nurses knew a lot more than me. Like so, for example, like things like, you know, amlodipine. No, I say, hey, what's that? I don't even know what's the dose of amlodipine, right? No, I'm like, is it 100 mg amlodipine? Then the nurse like, doctor, where got 100 mg one? It's usually 5 or 10. Yeah, correct. You know, it's kind of thing, right? So, and because they give it on a daily basis, they know it better than you. You know, you're fresh, you don't know what's amlodipine even, then like, what dose, right? So, these are small things that I rely on the nurses a lot, you know, for just guidance and things like that. And so, I always had that kind of relationship with them, and I think as a HO, you spend a lot more time in the wards with them also. So, you know, you'll be hanging out with them, and then there's a kind of bond lah. So as you get more senior, you are in the wards a bit less. You know, you are mainly in the there for the ward rounds and things like that. After that, you go and do your other stuff. So there's not much interaction as much as when you were a junior doctor lah. But definitely, you know, the bonds that were formed, let's say, you know, those nurses that I've seen growing up since I was a HO, then definitely we'll still say hi and yeah, that kind of thing.
Were there any key or particular moments in your career that shaped how you view and work with nurses? I mean, just now you already shared quite a lot about your experience, but anything else you want to add?
There are many moments where I fought a lot for the nurses lah, against rude patients lah. You know, so personally, I'm a kind of like a, I'm very, you know, I'm kind of like a gangster lah. Okay, not really a gangster.
Advocate lah, advocate lah.
Strong, passionate advocate.
I'm passionate about stuff lah. Okay, I'm passionate about stuff. Okay, so whenever I see my nurses getting mistreated by patients or rude family members, wow, it's like, to me, it's like, you know, I'm all ready to jump in. You know, I'm always spoiling for. Okay, I'm not spoiling for a fight, but I'm always like ready to like do something, right?
So your one ear is always there lah.
I'm always. So there are a few. If you all, I can share some stories.
Yeah, of course.
There's a very famous story of me when I was in AIMS. That time when AIMS was still actually still there, like ADTC there. Yeah. So I was just doing my own thing, you know, and then I saw this patient's family. I think it was the son. Yeah. So he was very angry about something, like waiting about something, right? So then he had a piece of tissue on his hand. Then he tossed it at the nurse, no? Throw away from me. Just toss it at the nurse. Then I was like, ho. I was telling me I was just doing my own thing. And I don't even think it was my patient. Yeah, it wasn't my patient's family member. You know, I was like typing. Yeah, I already could hear some kind of like, you know, his voice. He was raising his voice already, right? So already heightened, right? You know, 1 year already, right? Like, what's this guy doing? This joker, right? Shouting at my nurse, right? Then I was like, okay, never mind, just chill first. Then he tossed the tissue paper at my nurse. That was it. So I walked up here and said, sir, I don't think what you did was correct. I want you to say sorry to the nurse. He walked away, you know, Then I started chasing after him lah. And then Sister Geraldine, who I think she went to Woodlands already. Sister Geraldine was pulling me back. So I was chasing after him. He was like, no, who are you? I said, I'm the doctor here. I want you to say sorry to the nurse. I don't think you should throw something at my nurse like that. And you know, I'm not talking to you, so he ran away. In the end, he went downstairs to ED and he complained. So turns out they had to watch the CCTV footage. So my HOD, that time Prof. Jackie, had to actually watch the CCTV footage with Sister Geraldine and everything. And Sister Geraldine actually told me, very funny, they saw me, they saw the guy throw the tissue, they saw me jump out from my seat, and they saw Sister Geraldine putting my hand back, trying to restrain me from chasing. Yeah, it's quite funny and then epic. So it's like really like pulling me back as I was trying to chase. So yeah, so everything was captured, and I actually got an email from my HOD then. I think I was just a first year MO only. Say, oh no, or even at the last posting HO, I don't know. But anyway, it was like, you know, thank you for standing up for the nurses for this. Yeah, so nothing. I didn't get any punishment, anything. It was like really just a
rightfully so.
Like a compliment lah. Yeah. I mean, should I have chased after? Okay lah. I don't know. It's hard to say lah. Okay, but I was at the moment I was just like, hey, come on man, you can't do this kind of thing to my nurse, right? Yeah. So that was one funny story. Yeah.
Any more you want to share? Or not, we can ask the next question. Up to you.
Yeah, I mean, throughout the years, you all know more than me. Like, you all get a lot of abuse from patients and patients' families. I think there was once I was in a ward or so, then I saw a nurse crying. She was crying. She was in tears. You know, she was talking to the family member, and then she came back and she was in tears. Then I say, hey, what happened? You know, okay or not? So she actually. Like, you're also nice, right? You all don't want to tell me. So the first thing, you are crying already. I say, why? And you're like, it's okay. Then I'm like, no, it's not okay. Can you tell me? And she still don't want to say it. I have to like keep poking. Then she told me, oh, the family member asked me to go back to my country. I think she's a Burmese nurse. So she asked me to go back to my home country. Then I was like, oh, you, okay, right? So again, that wasn't even my patient, not my department, different department. I just went to the guy lah. I say, sir, can I understand what's going on? Why are you so upset? Okay, so he said, oh, my auntie is in the corridor bed. And I wasn't told that my auntie should be in the corridor bed. How can my auntie be in the corridor bed? We are Singaporean. So, so you know, when he says this kind of thing, then I'm like, okay, I know where this is going already. Which is probably why he told my nurse that, right? So I said, no such thing lah. So before you admitted to the corridor bed, someone would have explained to you in the ED and told you that, you know, you will be going to corridor bed. Are you okay or not? No, only then you sign and then they'll be okay lah.
Yeah.
So someone must have done it. So I told him that, then the guy was obviously shocked lah.
Yep.
No, because he was like all angry and all, like, no, I'm Singaporean. So he even said something like, can you get one of the people in the cubicle who's not Singaporean, get him out, and then put my auntie in. No, that kind of nonsense.
That's
Right?
wild.
You say this kind of thing, you know already lah, right? So I said, no, sir, no, very calmly.
Yep.
I think. I'm like, sir, you know, before your auntie stand up, you know, someone will explain. So he was suddenly stunned, you know, he was all being angry. Then he was like, oh really? Then he a bit like embarrassed, right? So he went to check. So it turns out that there was a helper who was with the patient, and the helper agreed and signed. The signature was there. So, you know, then he had nothing to say already. So I think, anyway, sir, I don't think that you should be using such language to my nurses. Okay, I think that is, no matter how angry you are, you cannot say these kind of things to my nurses. We are here to help you. You know, so he actually said sorry to the nurse after that. Yeah, so I just feel like you guys work too hard to be treated like that. And anyway, it doesn't really matter whether you work hard or not. The fact that you're a human being to another human being, you shouldn't be saying such things to anyone lah, and treating anyone like that lah. Yeah.
Okay. So like, what are some of the common challenges or barriers that you think doctors and nurses face when it comes to working together? Like maybe communication, miscomm, not taken seriously, like just now you mentioned, right?
Yeah. The relationship I had with the nurses has always been more of like a consultative. Like I ask you anything I don't know, I ask you, then you please teach me, and that kind of thing. So it's never any other. No, I think a lot of junior doctors, they kind of like look down on nurses. Then they think they are better than them, you know. And then when you get that kind of attitude across, when you talk to people in that certain way, they will know. The nurses will feel it one. You know, when you talk to them, you know, ask you a question, then you want to like give some kind of like sarcastic reply. No, then like for what, right? Then the nurses, when you talk to them like that, they will know what.
Yeah.
And then I always tell my juniors, like, if you do something wrong to a nurse, everybody's gonna know. Okay, they're going to go for break. They're going to go to the tea room.
Right.
And you go tell one person, go tell two will tell four people go tell eight. And everybody will know about you. Like after a while, right? If you are that kind of person, I think that kind of behavior is very hard to change. What we can do is we can do it from ourselves, right? We start from ground up. So for example, for me, I always behave in a certain way, and I hope that when my juniors see how I behave to the nurses, they will learn. You know, and of course I tell them lah. You know, I tell them, I give them tips. But at the end of the day, I can't change personalities.
Yep.
You cannot change people's character overnight. Yeah, they need to be able to understand that it's not right to behave like that, and then things can get better lah. I think on the other hand also, there are some nurses, especially probably the more senior ones, right, who maybe because when they were younger they were treated a certain way by doctors, then they'll like I feel like there's always this rage lah. You know, there's a kind of undercurrent, kind of like this unhappiness, right?
Yeah.
And then it will manifest, right? So no matter what, right? If you talk about just normal human being relationships, right? There's always, if there's some kind of underlying hate or like resentment, resentment, right? Then you will always translate to behavior, right? And sometimes it's subconscious one. You don't even, but you just say because you know deep inside I just don't like you already, you know. Then you go and like say something, then I'll sure act out, right? So I think sometimes the nurses, especially the more senior ones, they can maybe be a little bit more like, because they know what's going on. And then if there's some blur HO come and do something stupid, right? Then then the nurse is going to be like, maybe even like scolding, kind of attitude to the doctors, who then they will just generate, they will just just start something. Then this HO who got scolded by the nurse, right, will be like, hey, why ah? And then they start to get a bit of hate and resentment already, and then it builds. Then they become more senior. Then they start to bring the ones. So it's always like this cycle, vicious cycle that never ends. And how do we put a stop to it? I think from us, we start from wherever we are, and we try to influence things moving forward. We cannot change what has happened already, but I think,
Thanks for sharing. Okay, my next question is, how then do you think we can better work together? I mean, you said already, I think everyone, all our guests so far very, very good. And it's just like, I never even need to prompt you all, help me answer all my questions already. But how do you think we can, or is there any additional tips that you'd like to share for us to be able to better work together, to promote a more positive teaming culture?
I think definitely we try to get each other's names. I think that's the first step. Actually, really, I can tell you from experience, those good HOs and MOs, right, they are all a very common trait, They know the nurses' names one.
Oh, true.
You know, they are,
True,
you know,
yeah.
I'm sure you all know. I'm sure you all work
Yeah.
with HOs or MOs before, and some of them will like they call you by your name. Say, hey Kim, can you help me with this? No, and just like I think a very small touch like this will go a long way in terms of just making it a nicer place to work in.
Yeah.
So at the end of the day, we are all in the ward, especially HOs and MOs. Like, I mean, I'm not in the ward a lot lah. Not a consultant, okay, but MOHOs, right? They will be in the wards most of the time, and then you're going to be working with these people, what? So why not make it a more friendlier place?
Yep.
And you start off by knowing their names, and just make it a bit more personal, rather than just nurse do this, this nurse do that nurse do that. Yeah, so I feel that once you get to know each other on a deeper level than just being like colleagues, right? I think it goes a long way. I mean, go down, you buy coffee, then you buy a coffee for the nurse lah, something like that. Then like it goes a long way. Then you'll be like, wow, and it becomes not just co-workers, but you are actually friends. And then you and things will just start like things will be just easier from there on. Just like treating each other as friends, and then your culture, your working environment will be also better.
Yeah.
You come to work and because you're working with your friends, not because you want to like get it done your HO shit kind of nonsense. But you actually want to come and see your friends and help them out and like make it a nice place, Yeah.
That's nice to hear. Yeah, because honestly, we don't really have like a lot of like this type of relationships with the doctors. Like there's always this kind of barrier in between,
Yeah. Why you don't talk to the doctors?
Sometimes we talk, but it's still just very very work.
Just say, hey, hi, how are you? Hey, you going on leave or not? Chit chat a little
then
bit.
the doctor will look at me like, why are you asking me this personal question like that, ma?
That's true. Yeah, so I guess it's very hard. It's a chicken and egg, right? Like, how do we start, right? Then without being creepy, right? Maybe the guy can ask you, hey, where are you going after work? Then you're like, hey, why this doctor cheating on me? What the heck, right? So I understand there are probably challenges, but I guess we start like somewhere. I think people need to be receptive first, right? So when you're at work, you don't maybe like both nurses and doctors don't have like a RBF or like a front where it makes it difficult for me to communicate with you, Like then maybe that's the first step. I don't know. I personally that's what I do. I'm always very like smiley. Then I'll take the initiative to talk, like chit chat with people. Yeah. So I guess it's individual. It depends on individuals lah. Some people are a bit more extroverted. Some people are a bit more introverted. Yeah. But I'm sure there are small things we can do to show each other that we care lah.
Yeah. Of course.
You just pass the doctor like a piece of biscuit. I can already. I think the doctor very happy already. The that kind of thing like, hey doctor. No, like one of the most memorable things I had as a HO. The nurse just passed me a cup of water. Hey doctor, I think you work very hard. You just take a cup of water. It's like small things like that you will remember. Like it's a cup of water. It's like free, right? But it's like to you, it's
the
like
thought that someone.
The thought, I guess.
Yeah. So similarly, I think just recently only I helped a nurse to set the IV plug.
Whoa.
Then the nurse gave me a sweet,
Oh.
Yeah, I actually posted it on my Instagram. It's quite funny because I was quite touched because like, it's really not the sweet. It's like what? It's a sugus 10-cent sweet, kind of thing. But it was the gesture, that like that I showed I appreciate you, and thanks for the help. And it just it goes a long way, Just like I think small things like that actually, if you might not know it, but it might go a long way to the HO, to the MO, or to the nurse that you are doing that too.
100%. I remember there was this one time, right, I felt so bad because I think it was quite a new HO also. Then I remember her name also. Then now we're friends also lah. So I remember there's this one shift she came, right. Then I wanted to ask, I felt so bad, right. I wanted to change all my patient para to like 6 or 8 hourly, or like ask her to review the hypo count. Now I was like, oh my gosh, but there's like 6, 8 patients, right. So I was like, how should I best ask her? Because sometimes if you go there and you tell them a lot of things, then they get quite overwhelmed also. Then I don't want to do that. So I wrote everything on a post-it. Then after that, I drew some cute smiley face or heart shape or whatever. Then I just put there. Then after that, I carry this clipboard right at work. Then it's always on the cowl somewhere lah. So I think after she was done, right, then she helped me. Then she drew done. Then she drew something cute, so then she stick on my clipboard.
Oh, so cute.
So it's really all these small things, but you really need to be very intentional with doing it lah.
Yeah. But I guess like sometimes the stress like gets to like everyone, right? So like when you want to ask something and then after that you just be thinking like, oh, this person is like just irritating me, like I have so many things to do. Then like still, you ask me to change one para, or you ask me to like remove the posture BP taking and that kind of thing. Yeah, so I think like what Kim said, I really have to also like really bring it out of yourself to try to be nice.
It's
to
a
them.
very intentional
Yeah.
thing.
Yeah.
Yeah. But the name thing is it definitely helps.
It helps.
All the HOs and MOs that I feel like when they could join, right, like, then we ask each other, hey, what's your name? Oh, okay. Then the bond, like even after now they've rotated out, whatever, but you see them around the hospital, then you can call each other by name. All that. It really is
There's
a very
still some
small.
banter that you can have with them. Yeah.
Correct.
I think that, like, you know, being rude to someone is a choice. Okay, so wait, there's a very, very famous quote that I remember I heard. Being nice is a choice. Okay, being nice to someone is a choice.
Yep.
Okay, you can choose to be nice to someone. Like always, there's always a choice whether you want to be mean or nice. There's always in you to make the decision.
Yep.
Okay, so when you are stressed, everybody is stressed. What? There are two ways you can do it. You can snap at the nurse, or you can be nice to the nurse. You can like take a breath. Maybe you are really there, like super stressed, right? You have so many things, and then this nurse is like asking you to order like Panadol, you know? I don't know. Okay, like okay. So, but like there's no need to snap at the nurse, what? Because at the end of the day, the nurse is just doing his or her job.
Yep.
He's just telling you, right? You're stressed, but there's also the nurse also has his or her own duties, what? So if you look at it that way and you don't take it personally, then it's fine lah. Why you have to snap at people? Yeah. So I do call this kind of behavior out also. Sometimes I see my HOs and MOs like they snap at the nurse. I just like after rounds I'll just call them to the side and say, hey, just now, like, you know, there's no need to do that lah. Yeah, I understand that, you know, the nurse was bugging you about something which you felt is not important, but there's no need to talk to them like that. Okay, because there's always a way you can just tell yourself to not do it lah. You know, not behave like that. And yeah, it's a conscious effort lah. So your point about people being, you know, stressed and rude, it is true and it's a very real thing, and it's definitely something that happens a lot. But again, at the end of the day, it starts with us changing our behavior. Whether or not we recognize it first. Okay, so firstly we need to recognize. Some people, there are some doctors I've seen, right? They don't mean it one, but they're just, when they stress, they start snapping, or they start being like their voice, they talk a bit louder, you know, or they like seem a bit sarcastic. But actually they are quite nice, you know. Out of work, they're actually quite nice. But then when they are in that situation, they somehow behave like that. So maybe the first step is to really point out to them, like say, hey, do you know that just now, you know, when you were stressed out, you kind of like were a bit snarky and you talk a bit loud. Oh, then sometimes they might, oh really? And then they take it in and they might change from then on. But if you don't even talk to them about it or tell them about it, then it's very hard to. Sometimes they don't know. It's really not intentional, but they don't know.
I think similar to nurses' points also, like sometimes like on our end we're like snappy also, right? Then it kind of takes like maybe a third person like POV to like really like tell us like, hey, you know, just now not so nice lah, you know, can do better.
In the work zone lah.
Yeah,
in the
yeah,
hyperfixation.
I got another story. I got a story.
Oh yes, yes.
sure.
I got a story. When I was in another hospital. Can I say the hospital name?
Don't say
Maybe
that.
not
another place lah.
So I was in another hospital,
Yeah.
for my rotation,
Yeah.
which then narrows it down. There's a nurse who threw a case file at me, you know.
Whoa.
Yeah. Whoa, that was. I remember I was doing GenMed. I was MO, GenMed rotation or cardio. I can't remember. Anyway, so and I was being nice about it. I was just like, hey, sorry. At the time still a case file one, you know. They're not epic yet lah. Okay, so I a case file.
Yeah.
I was like, how anyone has a bed 20's case file? Then I was just like, then everybody, I think they were passing report lah, right? So
Yeah.
everybody ignore me.
Yeah.
Then like, then I just walking around, looking, I don't want to disturb people also, right?
Yeah.
Then I was like, then I was looking at the number, because behind the case file got the number of the bed, right?
Yeah.
So I was like trying to pick like, where is number 20, bed 20, right?
Yeah.
Then I like, I saw that there was a 2, but I cannot see the last digit. So I
Yeah.
asked the nurse, sorry, is this bed 20? Then the nurse was like, you just, because I mean, obviously, she knew that it was bed 20, right?
Yeah.
Then I was like, I didn't know, I cannot see the last number, what? So I was like, is this bed 20? Then she's like, then she just threw the file me, and then she drove off. Then I was like, whoa, then I turned around, I said, excuse me, please come back. So I told her, I said, I don't think that it's nice of you to throw the case file at me. I was just asking you for it nicely. I don't think that's right. I think you should apologize. Okay, sorry, doctor. I should off. So I mean, we at the end of the day, if we can be correct behavior on the spot.
Yep, that's the best.
I don't know whether it's the most suitable timing, but even if you wait too long, so then people forget, then you might probably will not do it. So maybe the best thing is just on the spot, you just tell them that, hey, I don't think that was nice for you.
Yeah.
And again, that boils down to whether you're a humble person, whether you can take in feedback properly. right? If everything I tell you, then you want to be defensive and you want to say blah 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 blah, got excuses for everything, then you are not going to improve lah. Then I think you all just give up on these kind of people, right? So I'm sure you all work with people. Every time you say something, they have an excuse. They are, but this, but that, but this one then okay lah, then forget it lah. Yeah. But I guess you still should try to give feedback first.
Yep.
Yeah. Then you see how it goes.
Right.
There are many memorable experiences and stories already. Before we end, do you have any more?
Wow.
I don't know, juicy ones.
Juicy
or like,
story.
you know,
Oh.
Wow. So okay, another story. So the time I was a registrar and I was supposed to review a hyponatremia patient.
Yeah.
And the sodium was very low. I think 115 or something, very low one. Okay, so I was like, oh my god, I'm going to see ASAP. And the time the ED was quite full, so they opened up decon. Right, so I was going to decon. Then I was like trying to find where is this patient in decon. Like you rushing there already.
Yeah.
So I saw, I think the patient was at the corner, but then somehow on my left there was a patient who started scolding vulgarities. Cause waited too long to get a bed already. Like, I waited 3 hours. So all the F words came out at the nurse.
Yeah.
So I was going to go to the sodium 115 patient. The F word. I turned around. I ran to him again. I said, sir, this is wrong. You should not be talking to my nurse like this.
Yeah.
Okay? I want you to say sorry right now. No, sir. Once again, you do not use vulgarities at us. No matter what. You have been waited for 3 hours, sure. Everybody here is waiting for 3 hours and more. But you cannot be using vulgarities at my nurse. I want you to say sorry right now. So I was not. So he wanted to say so many things, and I was just like, no, I'm not going to let you talk anymore until you say sorry. So I will just keep cutting him off until you say sorry. Then he was like, okay, sorry. Yeah. So then after that, the nurse after that turned around and said, hey, thanks, doctor. Yeah. Actually, I was thinking of it. Actually, I didn't really. For me also, I just wanted to scold him lah. So, but yeah, okay, you're welcome. But I just wanted to scold him. Yeah. I mean, cannot we cannot let people get away. So at the end of the day, really, I need you all also to take a stand against this kind of thing. People will continue being rude. People will continue being scolding vulgarities until they meet someone who tells them off. And then the next time so I'm very sure that guy whom I scolded, he will think twice against using F words next time. Vulgarities to definitely he will think twice. He might still do it again. But because I actually scolded him and asked him to say sorry, the next time he wants to do it, he might think twice. So the only thing that you can hope to do is by changing the behavior is by doing such things one at a time, and then like hopefully after many times then they stop. So that's what I feel very strongly about.
I can tell. Yeah, so sadly with that, we have come to the end of this episode. Thank you so much, Dr. Keefe, for sharing so passionately and for being our defender. The defender against abuse. But again, like what he said, it starts with you, man. You cannot wait for Dr. Keefe to magically appear in every situation to defend you. We must really stand up for ourselves. And at the same time, when it comes to doctor-nurse relationships, we hope that everyone can be a bit more intentional, being nice to each other, especially because our profession is quite an intense one, so it never hurts to be kind to each other. Yeah.
And that concludes the episode of this roll call. Remember that you can also check out our other podcasts on Spotify and find us on Instagram and TikTok at Nurses of TTSH.
Yeah, if you have any other topic suggestions or if you also want to be part of the team, feel free to DM us on Instagram as well. Thank you so much once again, and we'll see you in the next roll call. Bye-bye!